Today I'm going to talk about a lateral tilt of your pelvis, which is your pelvis tipped to the side. It's a bit of a tricky one really because your pelvis tips to the side with every step that you take when you're walking. If you break your walk down, you've got one standing leg and one swinging leg. So your leg is able to swing because your pelvis is tipped up slightly, so then gives you ground clearance. Then you step on this one, it tips this way, and then swings. If you're clipping your foot on the floor all the time, you're either really clumsy or your pelvis has got an issue with tipping. If somebody's told that you've got one leg longer than the other, it could be that you've got a lateral tilt of your pelvis, which then when they pull on your legs, one leg's longer than the other, it could be an illusion, a bit of a red herring, that I've got one leg longer than the other, I need a spacer in my shoe. When really the root cause is around here, you address that, your legs are the same length. If you've got a lateral tilt of your pelvis, problems can manifest up and down. So if you tip into one side, if I'm tipping to my right and then I go out for a run, I'm putting more weight down my right leg than my left leg. So my right ankle, knee, hip, all the muscles, they're going through more work than this one, so I'm building more muscle on this side than this side, but I am also prone to a bad knee, a bad ankle, a bad hip, because I'm working it harder. Problems can manifest up as well, because if your pelvis is level, then your spine goes straight up. If your pelvis is tipped ever so slightly, then your spine has to compensate for that. So it'll bend and it'll twist to stay straight. So that can manifest into soft tissue problems anywhere in your torso. So if you've got a reoccurring injury, I'd have a look at your pelvis, because this could be the root cause of a shoulder problem, a knee problem, an ankle problem, which you just keep getting seen to, but it keeps coming back. So if you see somebody like myself that does myofascial release, that does a posture assessment, I will check that your pelvis is level, and then we could maybe address the root cause of your problems rather than just treating that bad knee over and over and over again. So don't live with any niggles or any little aches and pains, because they manifest into the big problems. If you keep going out and you're getting niggles in that right knee over and over and over again, that will manifest into something big. If you've got a niggle in your lower back at work, not just training, that could manifest into something bigger. It could even manifest into a shoulder injury, when really if you got it addressed quick, then it wouldn't ever get that far. So prevention is better than the cure, basically. So hopefully book in, and I'll see you all soon.